Hey, Sarah.
Hello.
Oh, wonderful. Here.
Hold on one second. Can you hear me now?
Yes, we can hear you. And Dr. Hurley,
I'm here. Can you hear me?
yes, we can hear
Okay.
you. Okay, great. Go ahead and get started. Thanks everyone for joining us here today for our remote meet. For you to ask some of your questions. Today we have Dr. Rachel Hurley, who is a state epidemiologist with DPHE, and Sarah Thunberg, COVID-19 response team lead and senior COVID-19 advisor with CDPHE. We'll go through a couple of slides here at the top, and then we'll open it up for questions and answers. I'll ask you to hold your questions until the end during the Q&A portion, but just a little of instructions how to ask a question when the time comes. If you click on the participants icon and then the raise hand button, that'll let me know that you have a question that you would like to ask. I'll take the questions in the order that I receive them. I'll let you know when you're on the line to ask your question, and we'll just go through it that way here at the end. So to begin, I will hand it over to Dr. Hurley.
Great. Thank you so much. Good morning, everyone. Next slide, please. So I want to start the presentation by talking to you about the case counts that we have been seeing here in Colorado in the last couple of weeks. As I believe all of you are aware, we have continued to see an increase in cases here in the state. The increase in cases that we are experiencing right now is slower than the increase we experienced in the spring, but we certainly are seeing a steady increase. Along with this, one of the things that we are also seeing is increased testing occurring in the state. And so we do believe that some of this increase in testing, some of this increase in cases can be attributed to increased testing, but certainly not all of that. And this is really one of the reasons that we track not just case counts, but we also look at hospitalization data and percent positivity data coming from laboratories. And you'll see some of that data later in the presentation. So what we believe is occurring is we believe that there is less social distancing happening in the state at this point. We believe that Coloradans' behavior has changed, and that is potentially contributing to some of the increased transmission we're seeing. We also believe that more Coloradans are seeking testing in some instances. And one of the other factors that contributed to this very last increase that we see showing up today is a backlog of test results that we received late this week. Next slide. And this is a figure that helps you see some of the changes in our trends by smoothing out some of the data and looking at the trends weekly. So this shows you the number of cases that have occurred in Colorado by week in the state. And in this figure, you can see that clear upward trend. We do expect that once again, this current week, we will see an increase this week compared to last week in the number of cases. But of course, the data that you see in that last bar is incomplete because the week is not yet ended here in Colorado, of course. Next slide. And one of the things that we have noticed over time is that the individuals who are becoming infected with COVID-19 here in the state has changed over time. And one of the major ways that has changed is a decrease in the overall age of cases that are occurring here in the state. So we are seeing younger cases occurring, lots of cases occurring among individuals in their 20s and 30s. And you can see that as of July 4th or so, our average age of a case was 33 compared to upper 40s, which we experienced closer to the beginning of the epidemic here in the state. As we all know, younger people are less likely to have severe symptoms, but certainly can still go on to infect others. And we know that, younger individuals are less likely to have hospitalization and, as I mentioned, severe disease. But certainly we are also seeing hospitalizations occurring among these younger age groups. So I think just an important reminder that COVID-19 illness can be severe in all age groups, and that younger individuals are certainly contributing to spread of this virus, even if their symptoms are milder. Next slide. This is our hospitalization data. If you look at the dark blue line in this figure, it represents the number of Coloradans that are currently hospitalized for COVID-19 in the state. And you can see that significant decrease in the number of hospitalizations as we moved into the summer, a plateau that occurred in mid-June. And then really since about the end of June, we've started to see this gradual increase in the number of hospitalizations occurring. As I mentioned earlier, when we look at hospitalization data compared to case data, we see less of an increase in the number of hospitalizations compared to the number of cases that we're seeing increased. And we believe that is, of course, due to the fact that some of those cases that we're seeing an increase in can be attributed to increased testing occurring in the state. But this is good definitive evidence for us that we are, above and beyond the test increases in testing, we're seeing more disease transmission in the state, and that is now translating into increased hospitalizations in the state. Next slide. At this point, we estimate that the current reproductive number, that number R, is just above 1 in the state, and we believe that has been gradually increasing over the last couple of weeks. And so what that means is, on average, every Coloradan that is infected with COVID-19 goes on to infect just slightly more than one Coloradan. And that is really at a place when the R value is above 1, that is when we are in a place where we will see growth in the number of cases that are occurring. If you remember back to the spring, the R value we were seeing then was probably more in the 3 to 4 range. And it was at that time that we were experiencing exponential growth. But really, anytime the R value is above 1, we'll see growth. And so that's what's occurring right now. We're seeing growth, albeit at a slower rate than we saw in the spring. But at this point, we do expect to, unless social distancing levels change or other strategies decrease the amount of transmission that's occurring in the state, we can expect to continue to see a growth in the number of cases and hospitalizations that are occurring in the state. Next slide. And I will hand it over to Sarah to talk about testing.
Thanks so much, Dr. Herlihy. As Dr. Herlihy said earlier, we are seeing, at the same time we're seeing an increased number of cases, we're seeing an increase in the number of people who are getting tested. This is promising in that it demonstrates that we continue to increase our capacity to allow or to enable Coloradans to be tested when they are experiencing symptoms. So very, very important. We continue to break records in the number of daily tests we're having. One thing I will note, though, about the test results you see today, that far bar on the right, is that we had a late addition to our case reporting from one of the commercial labs, and it has skewed our results. We think that it's a couple of days of data that all came in today. So we are at about 11,000 tests today, but it is likely that several of those should have come over the last couple of days. But one of the things I really want to highlight is that our current positivity rate, so of those tested, the percent that come back positive remains below 5%. That is aligned with World Health Organization and CDC recommendations to keep that number below 5%. It's very important that as we see numbers of testing, number of positive cases increase, the number of tests increase. And we want to see these things sort of in flow together. And we want to keep that positivity rate below 5%. It's a really good indicator that we're capturing the full perspective of disease. So really, really solid data there. And we're seeing things move in the way, sort of flow together in the way we'd like to see it. Next slide. So one of the other things is that about 80% of the COVID testing capacity is within private or commercial laboratories. Those laboratories are not within the span of control of the Department of Public Health Environment or other state agencies. And so we don't have a lot of insight or influence in the time that it takes them to process samples and return results. At our state public health laboratory, we target a 24 to 48 hour turnaround time, though we prioritize the tests that we process based upon acuity and risk of those individuals being tested. So we really use our state public health laboratory to do outbreak investigation, to test at senior facilities, knowing that those individuals are likely to have higher consequences should they experience COVID illness. So we really prioritize those highest risk cases at the state public health laboratory. So sometimes our testing times might be, or our results turnaround times might be as high as 3 to 5 days. But we really emphasize high risk cases at the state lab. And that challenge of not controlling or influencing the turnaround times at private labs does generate longer test times. On supplies, my team and the team at CDPHE has done, and the Department of Public Safety have done exceptional work of procuring Colorado's own set of supplies. Currently, we have enough supplies, and we continue to procure huge amounts of testing supplies like swabs and extraction reagent and detection reagent. But there's always a chance that we will experience future shortages. We're working literally round the clock to procure additional supplies, and we'll continue to do that.
All right, thank you so much for that. So that concludes our update portion. So at this point, I'll open it up for questions. So again, if you have a question, please click on participants and then the raise hand icon so that I can see that you have a question to ask. Our first question will be from Chris Vanderveen. And if you could please say your media outlet as well as your name, that would be helpful.
Yeah, Chris Vanderveen, reporter with 9 News. My question is, it seems like we're getting a bit of an interesting picture of what's taking place in Colorado, that we have hospitalizations going up slowly, we have case counts going up slowly, our positivity still is where we want it to be in terms of below 5%. Is it the feeling of, Dr. Hurley, is it your thought that this is all a very manageable, while it's growth, it's still a manageable rate of growth, and that if we see this trend continue for the next few weeks, we'll still probably be okay? And then my other part of my question is, at what point do you think we're going to know maybe we're not okay? What are you going to look at that tells you maybe that manageable level of growth isn't so manageable?
Yeah, thank you. Those are great questions. And you're absolutely correct in that the amount of growth we are seeing right now is slower than what we experienced in the spring. It's fortunately slower than what many of our neighboring states have been experiencing. And you know, from the beginning, one of our guiding principles has been that we needed to ensure that our healthcare capacity was not exceeded. And with the limitation of our healthcare capacity being primarily critical care, so ICU type services for patients, and making sure that we have sufficient ICU beds and ventilators available for patients that might need that level of care. You know, one of the things that we are potentially seeing with younger cases occurring is that there are perhaps lower hospitalization rates overall. So individuals that are in their 30s or 40s are still being hospitalized, certainly, but not being hospitalized at the same rate as individuals in older age groups might be hospitalized. So our challenge is to closely monitor the level of growth that we are seeing from week to week here in the state, and also at the same time monitor hospital capacity and work with our healthcare partners to ensure they have the resources they need to continue to care for patients. And so that's really what is guiding our decision making and our surveillance strategy at this point.
Thank you. The next question will be from Vinny Del Giudice.
Okay, I just unmuted. This is Vinny Del Giudice at Bloomberg News in Denver. Question about JBS Greeley. We see it's still a hot spot, and now some numbers suggesting that it's extending. The intern program we noticed on your state data shows 5 people there infected. Do you have any idea what's going on in that situation, if these interns were working on the line or in the yard, anything like that? And really, at this time of the year, why are interns in a meat plant with all the problems that the line workers have experienced? Thank you.
Yeah, thank you. I think some of those questions would probably be best answered directly by JBS about their internship program. But we do know that those interns worked in multiple locations. There's also shared housing for those interns. So I think that there's a number of factors probably contributing to potential transmission there. As occurs with many outbreaks, there's the potential for transmission to occur in multiple settings, whether that's a community setting, a setting of housing, or while in the workplace. And it's often difficult to sort of detangle where exactly exposures are occurring, because we know multiple exposures occur for many people.
The next question will be from Blair Miller.
Hi guys, this is Blair Miller with Denver 7. I was curious if you had any reaction to the governor's talk yesterday about wearing a damn mask, but B, also the Douglas County Commissioner's move to leave the Tri-County Health Department in the middle of this pandemic.
Yes, this is Rachel. I can comment. So masks are absolutely a critical public health intervention, and we absolutely support the governor's messaging that masks are really important for individuals to be utilizing when they're out in public. As the governor mentioned yesterday, the state has a limited capacity enforcing mask ordinances, and it's really important for local communities to have buy-in locally to ensure that mask policies are adhered to. There is some level at the state level requirements around mask wearing. The governor's issued executive order requiring masks for all people in certain situations, including employers and staff working in mass transit, critical businesses, and critical government. And, the governor, as I mentioned, really, and through our public health order, we're really encouraging all Coloradans to wear a mask in public whenever it's feasible.
And this is Sarah Thunberg. I would add to that we are really encouraging individuals to wear masks and family groups to wear masks and to make mask wearing the culture of Colorado. The research is really clear that mandating something through policy is not nearly effective as creating social change from the ground up. And this is a great opportunity for communities of faith, communities of families of choice, book clubs, whatever that looks like, to make mask wearing part of your practice daily. And the more we do it as a community and more we collaborate on it, the more effective it's going to be. So I think that that's another thing we really want to emphasize, is that the more you do it and the more your communities do it, the more you send the message to other people who aren't wearing a mask and who aren't sure if they should wear a mask, that it's okay, it's part of Colorado's culture, and it's even better, and it's how we become and stay healthy.
And on Tri-County Health, any comment on that? In Douglas County moving to leave because of the mask mandate?
This is Sarah. My understanding is that this has been a conversation that's been in the works for many years. It's relatively new news, so I don't know the details, but my understanding is that it's not just because of the mask mandate, but rather a longstanding conversation. we have local jurisdiction for public health in Colorado. And so when local jurisdictions decide to team up, that's up to them. And sometimes that becomes a time that they also unteam.
The next question will be from Taylor Summers.
Hi, guys. Taylor Summers from NBC News Radio in Denver. Governor Polis said yesterday our estimated level of mask wearing was somewhere around 70%, maybe a little lower. But he wants to see that level to be higher, somewhere around 85, 90%. I was wondering if you could explain briefly how much mask wearing levels impact the R-naught value that you were talking about, which is now just above 1.
Yeah, this is Rachel. So mask wearing and other social distancing strategies are certainly going to have an overall impact on the R value where to decrease it. I can't say specifically, how much mask wearing would, what the absolute value is that mask wearing would decrease the R value. But absolutely it is contributing to the slowed transmission that we are seeing here in the state right now. If we didn't have mask use widespread in the state right now, I think we would be seeing transmission increasing at a faster rate than we are seeing. So I think it is certainly playing a really important role. And the governor's absolutely right in that the more mask use we can see in the state, along with other social distancing strategies, the more we can control transmission of this virus, and ideally result in an R value of less than 1 and a decrease in the transmission that's occurring.
The next question will be from Mark Craddock.
Hi, this is Mark Craddock with the World Journal newspaper in Walsenburg. New Mexico last week instituted strict quarantine rules for visitors from other states, as well as mandatory public mask wearing. Given the influx of summer vacationers that we're getting from high COVID regions, should Colorado consider similar measures?
Yeah, this is Rachel. I can address that question. So at this point, the messaging that we want visitors to Colorado to know is that if you are ill, you absolutely should stay home. And, as Sarah had mentioned, the sort of the cultural change in wearing masks, that's become the culture here in Colorado. And we want visitors to the state to also adhere to that culture and those social norms, that wearing masks is what we do in public here in the state, and to adhere to the recommendations that we have here in the state. We know that there potentially is risk associated with travel, but we want individuals to adhere to the best practices that we have here in the state, and make sure that travel to Colorado is as safe as it can possibly be.
Next question will be from Aaron Prater.
Hi, I think I just unmuted myself. This is Erin Prater with the Gazette in Colorado Springs. Curious when we might be able to expect more guidance on schools reopening this fall, and also about your response to reports, at least in Colorado Springs this week, that at least some school districts will not require mask wearing for all parties.
This is Sarah Thunberg. I think that we would encourage you to reach out to the Department of Education regarding those questions. Rachel, correct me if I'm wrong on that they're the keeper of those pieces of information.
Yeah, absolutely. I think that probably would be your best bet, is that they would be the folks that are really leading the charge and the guidance that's coming out.
The next question will be from Libby Smith.
Hi, Libby Smith with CBS4. It feels like in other states and in other areas that the increases get out of hand pretty quickly. Does the state feel confident in their capacity to react if these increases continue?
Yeah, so as I mentioned, we are closely tracking the growth rate in cases here. And, we've seen some variability in the amount of growth that we've seen from week to week. But in general, the amount of growth that we're seeing currently is much below the rates that we observed in the spring and below the rates that have been seen in some of our neighboring states. Certainly, we're paying close attention to it, though, and looking at that data regularly to make sure that we have the ability to detect an increasing rate of increase as soon as it's occurring here in the state, and to react to that as we potentially might need to.
I would add additionally that in order for us to maintain this great posture, we need Colorado residents to do their part also. And that looks like mask wearing and social distancing, and reducing the number of people they come in contact with. So we really, again, back to this idea of creating a culture of disease transmission reduction. We really want to be in partnership with every Coloradan on that.
This question will be from Jesse Aaron Paul.
Hey guys, I'm wondering if you could give an update on what the state's contact tracing system is like and how it's functioning, and also comment on how the contact tracing system is handling this uptick in cases, given that I think you all said that it could handle an upper limit of about 500 cases per day.
Yes, absolutely. So local public health agencies have jurisdiction to do communicable disease investigation and contact tracing. And we're seeing local public health agencies rapidly scale up their capacity. Additionally, at CDPHE, we have rapidly scaled up a workforce to support them and to provide surge capacity. We're using a Service Corps member forward model here, where we have an incredible partnership with AmeriCorps, VistaCorps, and Senior Corps. And over the last few weeks alone, we've onboarded, I think, around 250, onboarded and trained 250 new disease investigators, contact tracers, and other supports in this process. So we're rapidly scaling up, and that resource is coming online just in time to support our local public health agencies as they're seeing this growth occur.
All right, it looks like Chris Vanderveen has another question, and then I don't see any other hands raised. So I'll just say that if you have a question, go ahead and raise your hand now, and we might be able to take a couple of more questions before we wrap up.
Thanks for taking my question. I'm wondering, with potentially hundreds of thousands of kids going back to classroom settings in just about a month and a half to 2 months, is there the thought that the state is going to need, one, even more testing capability, and two, more quick turnarounds in order to try to keep schools open? Is there a plan in place when we've got all these kids going back to school and all these districts saying we're going to have students in classrooms? Don't we need a viable testing strategy in place at the same time?
We absolutely need to continue scaling the testing and ensuring that we have testing available for everybody who needs it. The alignment of testing strategy to reopening schools is, like Dr. Hurley, he said, being really facilitated by the Department of Education. And this is another place of really interesting local control in Colorado, that local school districts have control and have authority to determine their own plans. And we at CDPHE and in partnership with the Department of Education are really working in support of those plans and helping to provide technical assistance and guidance and match resources to what needs to happen. We also recognize that getting kids back to school is absolutely crucial. It's crucial for their development. It's crucial to enable our workforce to continue doing their jobs. As a mom of young kids, it's really hard to work a full-time job and be responsible for facilitating the online education of your kids. So we recognize that and are doing all of the planning work and the technical assistance and support we can to get kids back to school safely.
Yeah, hello again. This is Vinny Del Giudice at Bloomberg in Denver. Little bit more on JBS, if I may, and forgive me if you already said this. Contact tracing. The company is saying contact tracing pointed to the interns getting sick at the dormitory versus the plant. Do you have anything on contact tracing regarding this case and whether or not, well, maybe they got sick at the dormitories because they brought it back from the plant? Thank you very much.
Yeah, this is Rachel. I don't have those specific details in front of me at this point. So no, I don't have additional information I can provide on that at this time. But as I guess, as I mentioned earlier, it's often difficult to tease apart where exactly an exposure may have occurred. And that's because this is a respiratory virus, right? So you can and it's also a virus that causes asymptomatic infection. And so it's really challenging to specifically pinpoint where an individual has been exposed if they've been in potentially multiple locations where they could have acquired infection or been exposed to someone who has the infection.
All right. Well, at this time, I don't see any other questions. So we'll go ahead and end it here. Thanks again for joining us here this morning. Again, our speakers today were Dr. Rachel Herlihy, State Epidemiologist with CDPHE, and Sarah Thunberg, the COVID-19 Innovation Response Team Lead and Senior COVID-19 Advisor with CDPHE. Thank you all and have a wonderful Friday.